Septic shock, spinal shock, anaphylactic shock. What are all this? In today's video, we are going to have a clear idea. Welcome to my channel, Train with Brain Surgeon, and myself, Dr. Dhruv, Neurosurgeon, your NEET PG mentor. So, let's study this concept of all these three types of different shock with the help of two MCQs. Let's get started. First question. So, the vascular resistance is decreased in one of the following. Now, for this question to be answered, you have to be thorough with the definition of shock. So if you have not seen my previous videos, go check it out. So if I have to revise, shock is circulatory perfusion disturbance. That means the vital organs of the body are not receiving blood supply. So what does the body try to do? Send the blood from the peripheries to the center. That means the peripheral vessels are constricted and the peripheries are cold, and this leads to increased vascular resistance. But there is only one exception, and that's why it is there in the MCQ. So the answer to this question is distributive shock. Now, as I always teach, you have to split the word. Distributive means what is distributed? So the blood is redistributed from the center to the peripheries, and that's why the peripheral vessels are dilated. And how do they dilate? There will be decrease in vascular resistance. So it is also known as warm shock because the peripheries will be warm, unlike our other shocks where the peripheries will be cold. So now, three types of shocks are distributive shock. These are the examples. First, septic shock. Second, spinal or neurogenic shock. And third is anaphylaxis shock. How do the vessels dilate? The mechanism I am giving you in the table. So these are the reasons why the peripheries are warm and the blood is distributed from the center to the peripheries. Now, second question. Let's apply this theory knowledge and solve these questions. So there is a patient who is having burns, who has developed polyuria and lightheadedness. There is only one point in this question which can actually clinch the diagnosis, and you can solve the question within less than 30 seconds. And what is it? Warm peripheries. And now we know the only shock where the peripheries will be warm will be septic shock. So the answer to this MCQ becomes self-explanatory, and it is septic shock. So I hope the concept of distributive shock is very clear. If you are still not understood, do mention in the comment section. If you come across any questions associated with distributive shock where you are stuck and where you are not able to apply our rule, do mention in the comment section or DM me. Thanks for watching. Stay tuned.